I cannot see myself now.
Okay. Assalamu alaikum,
I just
everyone. Am
walaikum
I
assalam.
audible?
Hello. Good
Yes,
afternoon.
yes.
Yeah.
I am Kasmala Azam, a fourth year medical student at Rawalpindi Medical University. Currently, I am working as Senior Vice President OHCC. OHCC stands for Organization of Health and Economic Collaboration, founded on 23rd March 2021 by Danish Ali, with an aim to bridge the gap between economical and medical sectors of Pakistan and worldwide. We believe that health should be our first priority. To emphasize that, one aspect of health that is always ignored, I think, is mental health. We always talk about physical health and all that, but mental health is the most ignored aspect that we must emphasize. And to highlight that, today we have a great speaker, Dr. Muhammad Azeem Rao, a consultant psychiatrist and public health expert who is working in hospitals affiliated with Rawalpindi Medical University. So today we'll be having his words on how to stay happy or being high achiever at the same time. What's the right way to go through? So with that being said, over to you, sir.
So, yeah. Um, Many thanks, Kashmala. Uh, I think, am I audible clearly?
Yes,
Right,
you
sir.
are.
Or is there any noise you can have, you can feel?
No, sir, it's clear.
It's all good to go, sir.
Okay. Um, Very good afternoon. The topic is very interesting and seems very close to my own heart, because happiness is one thing and being high achiever is the other. And what is the right way to go? A few thoughts which we need to share together. And I think I will be going through a few slides, one after the other. And then I just want that at the end of the talk, we are able to understand a few concepts which we perhaps are not able to understand before. So therefore, I will be going very slowly, understanding that you are understanding them, trying to digest them, and then possibly we'll be moving forward so that we are wiser than before after having this talk. My name is Azeem Rao. I work as consultant psychiatrist at Rawalpindi Medical University, and I also lead a few public health programs, keeping in view my public health expertise, which I conceived. A little background about myself. I always try to start my presentation with this beautiful building, not only because this is only a beautiful building, but the rich cultural heritage and the great academicians this building has produced in the Great National Medical College, now a university. It has a lot of values which I think are very much inculcated in the organization and its alumni. And this is the building of the place where I did my public health from in Spain. Very interesting, 140 years old university. It's a Catholic university with a lot of history and great alumni on its dashboard. So just starting and giving you and sharing the overview of what we are going to discuss. All of you are looking for your good careers. All of us rather try to be high achievers, and for that matter, we have to work very hard. And what are we looking for is actually what is more important. It is important to take care of our health. It is important to take care of our achievements, or at the same time aren't we ignoring our happiness? And what are those possible components which we need to understand are important to achieve the happiness? And what is the technique that we should be able to understand, recognize, and able to practice these goals? And the final step is managing yourself or others. It means that are we able to manage ourselves in a way that we are doing very well. So starting and going along. what we want to do when the very senior persons who are very bright, for example, the student life, they are actually striving for their professional goals, or they just want to, others want to go into the business. And should we keep trying to achieve those objectives? And to what extent actually in our lives we need to work very hard to achieve our goals? Is there any time limit? What should we sacrifice? Should we keep sacrificing to achieve those goals, or there is a limit which we need to understand that this is a limit where across which we will not be able to, because since childhood we keep thinking and listening, try again. But is that a right concept to understand, try again, or we need to stop ourselves and then reaching and trying to achieve a few things which are more important? Um, so getting along, if I try to give you a few options, starting from the money, can you see the slides for money, fame, and skills?
Right,
Usman,
sir.
are you here?
Uh, yes,
All
sir.
right. So if I give you an option, that what will be you choosing between money and health, or health or money? You will prefer health over money, or money over health? Similarly, will you prefer your fame over your happiness? Or will you prefer skills over your relationships? The choice might not be very easy. And similarly, if I ask you to choose the reverse, that you are choosing your health in place of money, the choice is not easy. But have you even thought of this concept, that how we should need to understand and make our own choices? So therefore, if we are able to understand this concept, how we need to choose our objectives and how we need to, getting along to achieve those objectives, is I think the job is done. Okay. So getting along, who told you these concepts? Your parents. You have been, first of all, you are trained by your parents, and then are your teachers. Then comes your siblings or your friends who are very close to you, or yourself. One or the other way, these four types of mentors which I am able to identify as yet, they are teaching you, we are teaching ourselves, and then we are trying to make a few aims, and then we need to see whom we are following. Why I have put the teacher on green and yourself in the red? I think if you do the reverse, that will be okay. Teacher is one who guides you. Parents are also guiding you, but it is you who have to come up with the certain notions that you need to design your future. You need to design your own life, which means that you need to be architect of your life, which is an important concept that we all need to understand. And then concluding the concept, if we really agree that happiness is important or objectives are important to achieve that happiness, then we will be going on the next step. The next step is, have we ever tried to achieve those objectives which are important to achieve our achievements and at the same time our happiness? Have we ever tried that? If I ask and if I try to answer in place of you, the answer is honestly no. The third would be, and have we sought help to achieve those objectives? That what are those objectives and skills which we need to achieve in order to be happy or in order to achieve our goals in our lives? So, which means that this topic, this area is very new to all of us. That we do not know how to achieve the happiness at the same time while we are achieving our goals. I hope so far you are agreeing and you are with me.
Yes,
So
sir.
if I switch to the next slide, again, common happenings and or mistakes, you may say them. Excess of one thing and the loss of the other thing, which we please focus in here. Excess of study, you study a lot to be a professional. You are busy in the business to establish the business states, business empires. You are so busy in the religion that you are going on the religious festivities to achieve the your goals in religion, or you are very busy in being making friends. What are you sacrificing when you are working in all these areas? Excess of these things. Perhaps you are losing your career in here when you have a lot of friendships. You are losing your exercise and your joy while you are achieving or working more on the religion. Perhaps you, when while you are very much busy in establishing your own business state, you are missing your religion. Perhaps you might have gone to your mosque or your worship places for years while you were very busy in establishing your business, or you are missing your wonderful friends in your childhood while you were studying very hard, which is very common amongst the medical doctors. Possibly, I can say on their behalf because I have also gone through the same phase. So these are a few concepts. So the deal, if you see that you are doing so much in one area and at the same time you are losing in the other areas, so this deal is very tricky, and we all need to understand if we if the business was worth doing it. So this is the concept. Please emphasize and try to understand the concept. If we are doing this in excess, we are losing the other, or if we are losing the other, are we achieving in that place? This is worth doing it or not? In my understanding, I think this is not a fair deal. The first half of our life we are working too much to earn, and second half of life we are spending that earning to get back that health. So if we see this in that fashion, I think this will try to simplify the concept. um, then what will be your answer in here? If I ask Kashmala because she is in contact with me, would it be a fair deal, Kashmala? Can you hear me?
Yes, sir.
Okay. So, in my understanding, this is not a fair deal. This is not the right way. Then the question is, what is the right way to go? How we need uh, to to prioritize our life patterns. According to WHO, it's a health. What is health? It's a state of complete physical, mental, and social well-being, and not merely the absence of disease. If, for example, if we are in these four areas, we are complete, then person can cope with the normal stresses of life, can work productively, and able to make contribution to his or her community. If the person is physically, mentally well, he is contributing towards society, make a contribution to his or her society. I think this is what health is, and this is what happiness is possibly, because this is the more or less the whole components of life, that you are enjoying your physical health, your mental health, you are contributing to your society or towards your relationships. Possibly, we will see more. This is the definition of health, which means more or less this describes the same pattern. Getting along the same. If you divide yourself or your life into four areas of being professional, emotional component, where your love and hate with your or your relationships, your friends, this comes in your emotional component, or your spiritual component or your personal component, whereby you are close to your Almighty, your Prophet, your religion, whatsoever you are following. This is also one important component, and then your physical component. You are taking care of your physical health. You are taking regular exercise in terms of maintaining your health. If we are able to make a balance in these four areas in a certain fashion, then this comprises of the more or less the healthy lifestyle or balanced lifestyle, and this all leads to happiness. You are giving equal time to your friends, your own self, your love and hate. Um Please delete the hate word, because hate is also important component of our emotions, and but we need to understand the ethics of if you are not liking somebody. Professional component is very important. You achieve certain skills to get along certain professions and achieve a few skills. So is the physical and the spiritual component. So if you are trying to fulfilling these components, I think this is what happiness is. It's a balance, 25% each. We will see. So this overlapping is telling you that happiness is having the overlapping of all these four components. This will comprise of a balance which we need to achieve. So the question is it that easy? Had it been that easy, I think then every second person would have been very happy. But this is not the case. So which means that this is not an easy deal. It is not a easy job. We need to achieve a few things to achieve all those objectives. And what are those tools? Um, there are certain tools which we need to identify, which we need to understand. What is, if you look at this machinery, this doesn't work without having a certain chemistry with each other. You can see the knobs. If they go in a certain way, then this whole machinery will be able to work. Now, what fits in here? One, two, three. If this is not working well, this may not be able to work well, and so is the case with the so on and so forth. So, what are those tools? Let's have a look on this. How is your anger? How you are good enough to manage your own stress? How you are good enough to manage your own anger? Have we ever learned that to have to be at peace with our own selves? How you are able to deal with the difficult people, uh, be it is at home or at your workplace. Are you able to deal with the difficult people, or the environmental factors, you can say? Are we in the healthy lifestyle, which we have discussed, the four components? And therefore, this is the bigger portion. Healthy lifestyle is not very small. This comprises of the bigger portion. And so is the conflict management, conflicts at our workplaces or at our homes, in our environment. So this is how one or the other way these are interlinked. Getting along the same. We are on solutions now. Let's acknowledge or identify the potential areas which we have discussed and learn on how to fix those problems. For example, your anger problem. I may be poor at my relationships. I may be poor at my professional skills. If I identify that, then I'll be able to know how to improve that. And similarly, if we learn from the expert, then are we able to practice those areas? This is the third and foremost and important component to understand and achieve. So, getting along with the same, you are managing time or you are managing stress. They go hand in hand. Uh, in order to achieve that machinery to work really well, optimizing yourself by adopting stress and anger management, managing difficult people, or healthy lifestyle. If we are understanding these concepts, small concepts, then we are perhaps able to work really well, and that is which is the road to happiness. Okay. Um Getting along the same, and how the tools help us. These tools, if we are able to achieve, if we are able to understand, they allow us to stay at peace with our own selves. They allow us to stay at peace with others. Um, Whatever is the place, your environmental factors. And then you are contributing to society. If you are at peace with your own self, with the others, definitely you are contributing to society, which is the definition of health or happiness. I hope this makes sense so far. Okay.
Yes.
So, how we need to achieve those tools, keeping in view. Look, I am only mentioning the prototypes, the right tools, how we need to understand and manage. But this is not definitely easy and possible to understand this in one session. So therefore, we'll be only highlighting the important concepts so that we are better able to understand the concepts. The time management, stress, healthy lifestyle, how to achieve that, and so is the anger management. Um, let's see. This is the Eisenhower box. Eisenhower was the 34th president of US, and this is famous in his name. If we are managing our time in a way that we do urgent and important things at our own, do it. For example, you have to write the article today, it is urgent and it is important, you will do it yourself. If it is urgent but it is not important, you will delegate it to somebody else. For example, booking the flights or scheduling the interviews, you can delegate to any other person. You don't have to do it your own self. It is urgent, but it is not important. You will take the help or you will delegate it, right? Third box is, it is not urgent, but it is very important, which means that you have to exercise. Exercise is very important, but it is not urgent. You can schedule your time. You can decide the way you want to do it at 7 p.m. or 8 p.m. This is about your decision. So this is you will place the exercise in this box, decide. So is the case with the fourth box, whereby you will be deleting those things which are not neither urgent and nor important, which means it could be, for example, watching television or checking your social media. So this box you can delete, which means now you will be able to identify this, what comes in this box, what is in this box, and what is in this box. This will allow you to better able and manage your own self, your time. If you are managing your time, you are managing a lot of things automatically. The things will be different if we are putting the things in this box in here, checking the social media again and again. You are doing it urgently and importantly. Then the this is where the problem happens. Or we do not know what to put where. If we understand this box, I think this is very helpful practically. I have seen this. I have practiced it with so many people and students or my patients even. They find it really helpful. Okay, so next would be uh, this slide. Yeah. Cupboard shelf. Try to understand the concept of cupboard shelf. Everybody has the same cupboard, which means cupboard is like 24 hours. Now, what we'll be doing is that we need to understand what things to put in what place in your cupboard. More important will come forward, and the less important will go backward. So that is the cupboard phenomena or cupboard shelf. How you manage this. This also helps you understanding what is more important for me to do in to-do list. Again, this all the same which we have already talked about. Four concepts, four components in balance, which is leading to a better lifestyle or better management of our own selves. Uh, the idea is that don't sacrifice one for the other. 25% each in these concepts. In this concept, this is 25, this is 25, 25, 25. If we are sacrificing our physical component because of our professional component, which means this is not a balance. The balance is already out, and therefore we are not in the balanced or healthy lifestyle. So is the case with the other spiritual or personal or emotional component. You cannot miss one for the other. For example, I would suggest a banker who is doing a 10 hours job, how he'll be doing his exercise. He has given a lot of time to his professional component by staying in bank to meet the deadlines. I would suggest him to change his shoe or his dress. First, go to the, for example, the ground, have his exercise for 1 hour, and then go his home. Because he'll not be able to return when if he does it otherwise. He goes home, he will be occupied, will be attacked by his family, well, that the person is living again. This could be one smart option, that this kind of small techniques or small adjustment we have to make if we want to achieve these 25% each. Uh, Coming to stress. This is stress curve, which is, I love it actually, because this is so practical. This helps us understanding what is performance and what is level of stress. This y-axis shows your performance and x-axis is showing your stress level. Till in here, you see the stress is increasing and so is your performance. it is increasing in here, and you are in the green zone. Um, Till in here, your stress is also increasing, but your performance is also increasing till the time you are fatigued. This is the point you need to understand. You are being fatigued and you need a break in this place. If we continue working and continue having the same kind of stress, then there will be a plateau, we will be exhausted, and then the performance starts coming down. This is coming down. Have a look. This is coming down, and you are entering in the red zone where there is anxiety, there is panic attack, there is anger, and then we are breaking down, and there is a great burnout, and then you are in the ICU of your mental health, right? So we need to understand this is the optimum level of your performance with optimum stress in here. When you are here, you all need to understand that this is where we need a little breaks. We need to take our time out so that we are staying in the high performance zone with an optimum level of stress. Don't allow yourself to go beyond this. Okay, so this is where we need to take care of our own physical and mental health, and have positive talk to yourself. I am in control, I can meet my challenges. Avoid negative talk, I cannot cope, or this is too difficult to deal with. But realistically, of course, manage your strict timetable, stick to that, and then say no to extra work without feelings of guilt. This is very important. Everybody of us who refuses to extra work, he feels guilty of not helping others, not doing something else for others. And if we understand, I think this is very helpful for all of us if we are able to understand this. So maintain your own schedule and meet those timelines in terms of your professional and personal standards of goals. Ladies and gentlemen, this is the slide which you need to have a look at, and this is a break for me because I am also exhausted.
Yeah, that was good.
Yes.
The place where I work.
Right.
Yes, sir.
Institute of Psychiatry Collaborating Center.
Hmm. Can you identify me here?
Yes, sir.
Yes, yes, we can see.
Fifth person from my left, like on the right.
Yes.
Okay, maybe. How much time we are left with? Is 10 minutes, 20 minutes to go further?
Right,
Yes,
sir. We
sir.
have
But we
like
also
20,
have
25 minutes.
questions. So,
Yes,
Yeah,
we
yeah, we
have
will be taking
questions
questions at the end.
for our
Uh,
participants.
and Kashmala, if I could ask you, are there any questions so far?
sir, I've
Yes,
already
sir.
shared the question PDF on WhatsApp.
Okay. All right, so please keep posting, keep taking the questions. I'll be very happy to answer if anybody of you is not able to understand any concept or you
Sure,
disagree
sir.
with me at any point. Any one of you can frankly disagree because these concepts are not easy to understand and then difficult to practice.
Right, sir.
Okay,
Yes,
and
sir.
keep asking yourself, where are you lacking? Are you trying to allow yourself to fulfill all those components which I have mentioned in the healthy or balanced lifestyle? Or for example, you are able to manage your timelines, stress levels, how you get exhausted in different situations. And then the next thing is also very important, which I think every one of us uh, get through on everyday basis. So can you guess what would be that? You cannot. Hmm? So let's go. Let's move forward. Can I have water? Okay. So here we go. Is it a problem?
Anger management.
Nobody possibly exists on earth who has never experienced this. Rather, everybody of us has experienced it. Rather,
Right.
experienced it again and again. What we're doing here, our voice is loud. We are screaming, we are shouting, and it is no different than a psychotic state. Isn't it interesting?
Yeah, I actually agree with that.
Okay, thank you. Getting along the same, you will be wondering there is some healthy anger and there is an unhealthy anger. Have you ever thought of there is unhealthy anger? I'll be talking for a minute's time on this. What is unhealthy and what is healthy anger? Mechanism of how the anger is produced inside you. There is a stimulus, somebody has crossed your car very abruptly, very suddenly. You make a concept that he is a man who is just 15 years old and who is trying to learn how to drive, and therefore he is enjoying on the road, and we react that he is one of those persons who is actually a new billionaire, and therefore he is trying to show off, or possibly he is not taking care of the other. This is our reaction. uh, Now what happens is, if we listen to the person, what is happening inside us. For example, we are in an argument with somebody. We react first, then we think, and then it is called anger, which is an irrational response, which is unhealthy. You are listening, you are reacting, and then thinking, and therefore thinking is red. This is in the dangerous zone, right? And this is producing unhealthy anger. Okay, so have a look on the other way. If we place this thing somewhere here, just before the react thing, you listen to somebody, then you thought of something, what or she is talking about. You are thinking for a minute's time, 10 seconds, 20 seconds, and then you are reacting, right? This is now rational response because you are allowed your frontal lobe to work in a rational way. Listen, think, and then react. This is rational response. Reaction, when thinking was in here, it was a reaction. This is bad. Whereas when you think and then you respond, this is rational response, which is good. You can say it healthy anger. This is unhealthy anger, right? So
Right.
if the idea is that you have to bring this thing from this order to this order, and the people are not able to bring this for the rest of their lives if they do not understand the concept where we need to place this thing. If we are able to, I think I am very happy. And then there are two types of anger sufferers. The persons who suffer, who are not able to manage their anger. Either they are like fireworks, they are uh, flooding like anything at any time, like fireworks. And people who are angry but they are silent sufferers. They never express their anger. So both are not good. Many of us are silent sufferers, and many of us are like fireworks. This is not healthy. This is also not healthy. So what we need to do is actually we need to understand if the same. If we are understanding this order, I think we will always be neither we will be like fireworks nor will be like silent sufferer, because this will be your rational response. You are translating your anger, your frustration into some rational response, and therefore you are not suffering in silence. Right? This is the answer to both of them. This is a very important concept. What we all understand and need so far is that why people don't change, why the next person is not doing this or that. Whereas you cannot handle others, you can handle yourself. You are responsible of your anger, not the stimulus. The next person who is igniting you, he is not making you, he is not responsible for your anger. Rather, you are yourself. Nobody can upset you without your consent, without your permission. If you will allow yourself to be angry, then you will be angry and you will lose your temper. Whereas if you are in good self control, what we talked about, managing yourself, this is all about managing your own self. Okay. So on the next is also very important. Stress can sometimes turn into anger. It's a secondary emotion. You have to identify the primary emotion, which is leading to this secondary emotion of anger. What would be that primary emotion? What would be that primary emotion? It could be different. For example, this you are having some financial crisis. Your mother is sick back home. You are anxious because of your exams. Your promotion is impending. Um, you have full bladder, very important, and you are not able to understand what is the reason of your anxiety, right? You are dependent on your tea, and you are not able to get that. One of the problems which I actually go through, you may agree or disagree because this is a problem, right? So you have to identify the primary emotion. This out of these, this could be anything, right? So how we will be managing this emotion? Stop the production of unhealthy anger. We have to understand what is the unhealthy anger. Remember, it's your choice to become angry, not driven by some Johnny's action. The Johnny's action could be the young person who was driving a car. He could be your brother, your sister, your colleague, anybody who is allowing you to put into unhealthy anger. You have to be aware of that. It is your choice to be angry or not angry. The 30-second rule is the same. Listen, think, and then react. This is 30-second rule. Okay, here we end the
Right,
talk.
sir.
Now we can have questions.
Right, sir. Kushmala, can you kindly please refer the questions to Rida Zara so that she can ask questions and all the queries related to this topic?
I
And
have
also,
already shared the questions. Please continue.
the questions are shared
Okay,
with me.
uh, there are some questions by the participants. I'll be asking them one by one.
Sure.
First question is how to deal with insomnia, distracting thoughts, and guilt. How to motivate yourself to achieve your goals.
There are three questions in one question. So identify and select one, which could be the, for example, first is insomnia. Similarly, look, insomnia is also not a disease. This is also secondary to some other problem. For example, you are suffering from, for example, anxiety or depression, or you are worried because of your exams or any problem which is around you. So therefore, if we understand that, we will manage depression, we will manage anxiety, the sleep will be managed automatically. And there are certain techniques. There are pharmacological techniques and non-pharmacological techniques. In the pharmacological techniques, if that is needed, that has to be done by somebody who is a professional doctor, because nobody else can prescribe medication. If you need that, the doctor will decide, not yourself. The second, non-pharmacological techniques, I think we all can adopt if we want to manage our good sleep. For example, manage your activity scheduling. There should be a strict schedule to get up and sleep. You are doing your regular exercise. You are not having caffeine, Coca-Cola drinks after the sunset. You are having your regular exercise, or at the while you are going to bed, um, a hot water shower or hot milk if it suits you. This kind of techniques, small techniques, you can apply to your own self, and I'm sure these are very helpful. These are called. This is also called sleep hygiene. If we follow the sleep hygiene, I think non-pharmacological it is very helpful. Yes. What is the next? These are the questions.
Right.
The next question
No, so
is ways
ways
to
to
relieve
relieve
stress of
mind
study.
stress of study.
This is amazing. I think very important. If we right, the exam or study stress is definitely a huge stress for the students, especially those who are getting along with certain goals. If we are managing our time, which we have mentioned and talked about in the during the presentation, for example, You are managing your time on everyday basis. That this is my sleep time, this is my study time, this is my time to exercise or my food. Then you will be possibly be able to manage your studies in a constant and constant fashion. It does, for example, this will you will not be able to achieve that if we are following the sleep pattern on one day and not the other day. Our routines are not settled. We are studying 8 hours for one week and not studying at all for rest of the month. So this will never allow you to help with your own stress. So therefore, you need to make your own pattern schedule and then stick with that. Make a schedule, make your activity scheduling, try to follow that. As I mentioned, follow the strict timetable. So this will help you to build on your certain routines to manage your stress. Does that answer the question?
Yes, sir.
The next is how to focus towards studies, especially when you are reviving of what you have already studied.
What you have already.
Um, already studied, right? Look, these are the questions which we are. I will be skipping those which are not possible to answer in only after the presentation. That too in the limited time, because we all need to understand a certain techniques to make our studies worth doing it and worth following it, because a few people are now you have to specifically tell me what are what are the possible barriers which don't allow you to focus on your studies. So according to that, it is possible to suggest the possible solutions. So, all right. So the next would be how to cope with depression. You cannot cope with depression, gentlemen, because depression is the name of when you are not able to help your own self. And it is the hopelessness and helplessness. Hopelessness is you are hopeless, you are not able to help yourself, and helplessness is the others are not able to help you. So therefore, the expert, somebody expert has to come in and help you. And depression, how to cope with depression? Perhaps you want to ask how to cope with the stress, because if there is depression, depression means that you are having low mood, decreased energy, and the three code, which is an anhedonia, lack of interest, for continuous 14 days is fulfilling the criteria of depressive illness. So while we say depression, it is not actually depression; it is being very upset. So you can say you are upset these days, or the depression is a clinical criteria. So you have to understand that.
Sir, I have a question, like sort of you can say that will be funny, but someone is asking again and again.
No question is funny. It is. Please do go ahead. What is the question?
Okay, sir. Someone like female participant is saying that sometimes I wonder that I just want to drink all coke from this world. It's
Not,
like that.
not able to.
I just want to
Like,
drink all the coke that is present on earth. So how do you see that and such
like, is it
hallucinations?
a mental disorder?
Coca-Cola.
Yes,
Yeah,
sir.
exactly. And she
Oh
says
wow,
that she's
very
actually doing that.
interesting. I think it is. It is. It is. It is not. It's a very genuine question. Whereas we all need to understand that this drink is not healthy, and it has caffeine or it is a carbonated drink, so it has some habituation actually. Like the tea we have, the habituation. We don't say it addiction, but it is habituation, and therefore we need to understand since it is also unhealthy, it is carrying a lot of sugar and energy, so we need to manage our healthy or eating or drinking habits. So what you can do in the first place is that you don't bring the extra which we bring usually at home. One habit is this. The second could be always share your calories with your colleagues, your friends, your family, that you are not having the separate bottle for your own self. You can share, which means that you are decreasing your calories to half already, and then perhaps understanding that I will be gradually decreasing it over a week's time. Make a start date and then end date. then you will be possibly able to achieve that you can avoid this drink. And I think, and a few people, if they want to stop that abruptly, this is also possible. You can also do that.
Right, sir. That's so brilliant of you, sir. Thank you so much.
The next question is about
Any other question?
maladaptive daydreaming and why it's not considered as a disorder and how to manage it.
Maladaptive.
Daydreaming.
Daydreaming.
No, sorry, I did not get that.
It's about
Um,
maladaptive daydreaming and why it's
Daydreaming. Okay. It is not
not.
considered a disorder, and how to manage it. No, I think not possible again to answer the question in one go. Daydreaming, and there is no maladaptive daydreaming. If somebody is daydreaming, we need to understand and assess why it is happening, because this is secondary to some problem, like anxiety or depression or something in the background. It is not only one symptom. So the proper assessment is the answer.
All right.
Next.
And someone is asking how to remain motivated to your goals, how to develop self confidence.
And now let me, because I have the list, so I can choose the
All
question
right.
which I think are important to answer. How to combat social anxiety? If you have social anxiety, the question number seven, and I think that needs to be answered and treated. Actually, there is no single answer that you can manage your social anxiety. If you fulfill the criteria of social anxiety, I think that needs to be treated with the medication. 6 to 9 months medication down the lane, you will be perfectly all right. How to be positive in this negative world? All right, let me have a look. How do I? Yeah, can anxiety that's leading to chest tightness, stomach ache, and constant discomfort? Very important question. These are all features of anxiety disorder, and people are actually, why I am answering this question, because most of the people who are presenting with these complaints, they are going from one doctor to the other, and the doctors are not. Many times they are identified, and many times they are not, and they are losing their precious time in terms of their academic careers. That needs to be treated very easy, and I think very simple to treat with the medication paroxetine. We treat with paroxetine for 6 to 9 months, and the patients are doing perfectly fine. So this is very important. Now let me have a look at the next. Do we have still time to answer the questions?
Yes, sir.
Okay. All right. How much time we have?
So it's up to you. Like we can have 10 to 15 minutes if you want.
All right, that makes sense. Uh, yeah, one more important question is that how you can cope up with your bad incidents, your in the past. I think this is so very important to, if we are able to forget and overcome those bad incidents, because of the fact that if we linger on with the bad incidents which happened in the past, I think they keep disturbing you, and therefore it is so very important to ignore them, to divert your attention from them, getting yourself busy in some any activity which you want find is healthy or important. This kind of small techniques, having regular exercise, and then allowing yourself that this is disturbing your mental health. This will allow you to distract from those bad incidents in the past, or distracting yourself very positively, and understand this is, for example, I told, in the presentation we discussed, it is your choice to be disturbed by those kind of toxic events in the past, or you just want to linger on and keep your baggage very heavy. So please try to forget that. And then the next question is how to cope with panic attacks. You cannot cope with the panic attacks. Panic attacks are always treated by the psychiatrist. So please do not struggle with yourself. Go to your doctor. This will be very helpful. And again, I would say the treatment is very simple for 6 months. Down the line, we treat those patients and they are very well. Next is, uh, how do you feel exhausted? Most of the times without any reason. If you are exhausted without any reasons, then it also needs some proper assessment, because either it's a physical reason, anemia, or any other physical illness which the physician will rule out. And if they are clear and then still you are exhausted, then it could be a possible depression or anxiety which you need to look at. Or this could be your laziness as well. We all need to understand, if it is your laziness, procrastination, which we say, this is also one of the reasons that we stay exhausted all the time. Okay. How how can one stay sane and mentally sound if we have a lot of problems in our life? I think it is very important. It is so very important that we need to take care of our mental health. The techniques which we have taught and mentioned and shared together, that what are those good techniques to stay mentally healthy when we have a lot of problems. This we talked about anger management, we talked about our stress management, we talked about our time management, and then how to adopt healthy lifestyle. This is the great answer to your question, that how you can stay healthy and happy for good periods of your life when you need to actually stay healthy, rather than in place that you are, when you are not managing your stress, when you are not managing your
से
time,
पूछ रही हूँ
then
उधारी होता है
definitely
ना,
you cannot
एंडिंग में
enjoy
कैसे एंडिंग करनी है, करना है
the
उसमें क्या नेक्स्ट
happiness
सेशंस होंगे, लाइक कल
or
परसों या
optimum mental
कुछ भी
health.
नहीं बोलना उस
So
पर.
therefore, managing modification in your lifestyle is very important. I can still have a look on a few more if there is anything else which is interesting or important. What do I do if support doesn't help? How to overcome emotional breakdown? Look, when there is an emotional breakdown or you are not able to manage yourself, what we do when our car is not working very well, what we do, we always try to find a better mechanic for our car. So is the case with your mental health. If you are not doing very well, you are not satisfied, you need to identify and find a better doctor for your own self. I think this is of great help. If you need medication, they are life changing. They are very helpful medication without addiction potential. And if they are given in the supervised fashion by an expert, I think it is not a problem. The problem happens when you play yourself with the medication, with the benzodiazepines and other stuff. That creates a lot of problems in your life. Whereas under supervision, it is absolutely fine. And if you are not able to manage, find a better doctor. Okay, phobias and anxiety we have already answered. How do you deal with social anxiety? Answer is again the doctor, the psychiatrist. How to deal with your all right. So more or less, I think these questions are being repeated. So this is how the possibly the end of the question which you have raised. And if there's anything else, you can still ask.
Kshmala, can you please see? I cannot find any more questions on Facebook Live. If you have anyone,
No, I guess that's all from the question answer session.
I am very happy to have you all together, and I think, and I wish you find this talk helpful. My last question, submission to you all would be: take care of your optimum mental health, the components of life which we have described. Have regular exercise, find time for your own self, manage your time and day, and then you will be possibly be enjoying your time very in a very smart way. Thank you very much for having me.
Thank you so much, sir.
sir, just a question, sir. Someone is asking if they can have an appointment with you, then how can they approach you? Like on these available links and number or anything else?
In the if you are able to show the slide, I think it is also mentioning the contacts, the contacts on the
Yes,
slide. If you are
website
able to share,
and contact number.
can you show that?
Yes,
So
sir. It's
Yeah, it
visible.
is. I can speak it for you. It's 0333 530 3130. Um,
right, sir.
or you can reach the website
Sure,
or
sir. Sure.
email.
Thank you so much.
All right. Many thanks
Thank,
for having me. Take care. Bye.
thank you so much, sir, for your precious time, and we'll be looking forward to have more sessions with you soon, inshallah. And we'll be more than happy to have a certified physical workshop under your supervision if you allow us later on. Thank you so much.
We can always talk about that. Many thanks. Take care.
Okay, thank you, sir. Allah Hafiz.
Bye.
Allah Hafiz.
Nice talk.